Pediatric medication dosing is not just a smaller version of adult dosing. Instead, it's carefully calculated, often based on weight or body surface area. Weight-based dosing is most commonly used, while body surface area is typically employed for critical care medications and chemotherapy. But what makes pediatric dosing unique? Let's break it down. Pediatric medication dosage differs from adult doses. Pediatric medication dosing uses established, safe, and effective ranges. These ranges account for metabolism, body composition, and developmental differences. Every medication has a range. The minimum effective dose, which is the smallest dose likely to achieve the desired therapeutic effect, and then the maximum safe dose, which is the upper limit before the risk of toxicity or side effects increases. Let's look at an example. Here is a pediatric dosing for amoxicillin. Amoxicillin 20 to 40 milligrams per kilogram per day, divided into doses every 8 hours. The pediatric dose must fall within the recommended low and high ranges. The low range would be 20 milligrams per kilogram per day, divided into doses every 8 hours. The high range would be 40 milligrams per kilogram per day, divided into doses every 8 hours. The dose must be within the range of the low and the high doses. If the dose is lower than the low dose, the drug may be ineffective. If the dose is higher than the high dose, then the drug may be toxic. If the patient's weight is 17 kilograms, the low dose is calculated by multiplying 20 milligrams by 17, which equals 340 milligrams. This gives you the daily low dose. If the patient is receiving the medication 3 times a day, the low dose would be 340 milligrams divided by 3, or 113 milligrams every 8 hours. The high dose is calculated by multiplying 40 milligrams by 17, which equals 680 milligrams for the daily high dose. Divide the 680 milligrams by 3, and you get the high dose as 227 milligrams every 8 hours. The prescribed dosage must be between 113 milligrams and 227 milligrams every 8 hours to fall within the safe and effective range. Pediatric dosing requires 3 steps. Calculate the dose based on the weight, check if it falls within the safe range, and also confirm if the total daily dose is also safe. Let's look at another example. The order reads amoxicillin 250 milligrams every 8 hours. The child's weight is 18 kilograms. The reference safe dose range is 20 to 40 milligrams per kilogram per day, divided into 3 doses. You don't have to calculate the dose to administer based on the weight. That's already done for you. But you must determine if the dosage of 250 milligrams every 8 hours falls within the safe dosage range. Check if the patient's dose is safe. The low dose range is 20 milligrams times 18 kilograms divided by 3. The low dose is 120 milligrams every 8 hours. The patient's dose is 250 milligrams, which is above the low dose, so that is good. Now you need to ensure it is at or below the high dose. The high dose is 40 milligrams times 18 divided by 3. The high dose is 240 milligrams every 8 hours. This number is lower than the 250 milligrams ordered. This dose is not safe based on standard guidelines. The provider should be contacted to review and possibly adjust the dose. The safe daily range of this medication for this patient is between 360 and 720 milligrams per day, or between 120 and 240 milligrams every 8 hours. Let's look at another example. The order reads ibuprofen 100 milligrams every 6 hours, PRN. The child's weight is 15 kilograms. The reference safe dose range is 5 to 10 milligrams per kilogram per day, every 6 to 8 hours. Do not exceed 40 milligrams per kilogram per day. You don't have to calculate the dose to administer based on weight. That is already done for you. But you must determine if the dosage of 100 milligrams every 6 hours falls within the safe dosage range. The low dose range is 5 milligrams times 15 kilograms. The low dose is 75 milligrams every 6 hours. The patient's dose is 100 milligrams, which is above the low dose, so that is good. Now you need to ensure it is at or below the high dose. The high dose is 10 milligrams times 15. The high dose is 150 milligrams every 6 hours. This number is higher than the 100 milligrams ordered. This dose is safe, falling between the low and high dose range. The daily dose should not exceed 40 milligrams per kilogram per day. That works out to be 40 milligrams times 15 kilograms, or 600 milligrams per day. If the patient receives 100 milligrams 4 times a day, that would be 400 milligrams, which is below the 600 milligram limit. Again, the dose is safe to administer. The safe daily range of this medication for this patient is between 75 and 100 milligrams every 6 hours, with no more than 600 milligrams per day. Let's consider another example where you need to calculate the dose to be administered based on the patient's weight. The order reads amoxicillin 40 milligrams per kilogram per day, divided every 12 hours, so administer in 2 doses. The child's weight is 18 kilograms. The reference safe dose range is 20 to 90 milligrams per kilogram per day in divided doses. The supply is amoxicillin 250 milligrams in a 5 milliliter oral suspension. This is a weight-based dosage. Calculate the patient dose based on the patient's weight of 18 kilograms. 40 milligrams times 18 kilograms equals 720 milligrams, divided by 2 doses equals 360 milligrams per dose. Set up your proportion. The first ratio is the medication supplied, 250 milligrams per 5 milliliters. The second ratio is the desired dose, 360 milligrams per X milliliters. Solve for the number of milliliters by cross-multiplying 250 milligrams times X and 360 milligrams times 5. That results in 250X equals 1800. Divide both sides by 250 to solve for X. X equals 7.2 milliliters. You would administer 7.2 milliliters of the amoxicillin oral suspension. Now you need to determine if this dose is within the safe range, considering both the low and high limits. The low dose range is 20 milligrams times 18 kilograms divided by 2. Twice a day would be every 12 hours. The low dose is 180 milligrams every 12 hours, and the patient's dose is 360 milligrams, which is above the low dose, so that is good. Now you need to ensure it is at or below the high dose. The high dose is 90 milligrams times 18 divided by 2. The high dose is 810 milligrams every 12 hours. This number is higher than the 360 milligrams ordered. This dose is safe, falling between the low and high dose range. The safe daily range of this medication for this patient is between 360 and 620 milligrams daily and between 180 and 810 milligrams every 12 hours. The 360 milligram dose is within the safe range. Let's complete another example. The order reads ibuprofen 10 milligrams per kilogram every 6 hours, PRN. The child's weight is 22 kilograms. The reference safe dose range is 5 to 10 milligrams per kilogram every 6 hours. Supplied is ibuprofen 100 milligrams per 5 milliliters of oral suspension. First, we calculate the patient dose. 10 milligrams times 22 kilograms equals 220 milligrams per dose. Calculate the amount of medication to administer. Set up your proportion. The first ratio is the medication supplied, 100 milligrams per 5 milliliters. The second ratio is the desired dose, 220 milligrams per X milliliters. Solve for the number of milliliters by cross-multiplying 100 milligrams times X and 220 times 5. That results in 100X equals 1100. Divide both sides by 100 to solve for X. X equals 11. You would administer 11 milliliters of the ibuprofen oral suspension. But now you must determine if this is a safe dose within the low and high ranges. The low dose range is 5 milligrams times 22 kilograms. The low dose is 110 milligrams every 6 hours. The patient's dose is 220 milligrams, which is above the low dose, so that is good. Now you need to ensure it is at or below the high dose. The high dose is 10 milligrams times 22. The high dose is 220 milligrams every 6 hours. This number is the same as 220 milligrams ordered. This dose is safe, falling between the low and high dose range. The safe daily range of this medication for this patient is between 110 and 220 milligrams every 6 hours. The 220 dose is within the safe range. Just made it. Let's complete one final example. The order reads azithromycin 12 milligrams per kilogram per day once daily. The child's weight is 15 kilograms. The reference safe dose range is 10 to 12 milligrams per kilogram per day. It's supplied as azithromycin, 200 milligrams, in 5 milliliter oral suspension. First, calculate the patient dose. 12 milligrams times 15 kilograms equals 180 milligrams per dose. Calculate the amount of medication to administer. Set up your proportion. The first ratio is the medication supplied, 200 milligrams per 5 milliliters. The second ratio is the desired dose, 180 milligrams per X milliliters. Solve for the number of milliliters by cross-multiplying. 200 times X and 180 times 5. That equals 200X equals 900. Divide both sides by 200 to solve for X. X equals 4.5 milliliters. Administer 4.5 milliliters of the azithromycin oral suspension. Now you must determine if this dose falls within the safe range, considering both the low and high limits. The low dose range is 10 milligrams times 15 kilograms. The recommended low dose is 150 milligrams daily. The patient's dose is 180 milligrams, which is above the low dose, and that is good. Now you need to ensure it's at or below the high dose. The high dose is 12 milligrams times 15 kilograms. The high dose is 180 milligrams daily. This number corresponds to the 180 milligrams ordered. This dose is safe, falling between the low and high dose range. The safe daily dose range for this medication in this patient is between 150 and 180 milligrams daily. The 180 milligram dose is within the safe range. Just made it. When dosing by weight, always confirm the max dose limits to avoid overdosing. Check if the dose is per dose or per day. This changes your math. And use the most accurate weight in kilograms. Avoid estimating. Pediatric dosing is precise. It's not just about numbers. It's about safety, effectiveness, and the best possible outcome for every child. Understand the weight, check the range, and calculate carefully. Thanks for watching. If this video was helpful, give it a like, share it with your classmates or coworkers, and subscribe for more nursing education content. You can find more videos at nursevideohub.com. Watch, learn, and care.